There have been some sporadic cases of patients outside of China who were ill in late 2019, but were only discovered to have had COVID-19 many months later. At the time of their sickness, of course, no one knew what COVID-19 was, and most doctors didn't test for it until January of 2020. But in some cases, clinical samples were taken, preserved, and later re-examined. This is what happened to a young woman in Italy who presented at a hospital in Milan with a strange rash in November of 2019. Doctors didn't know what it was. They took a sample, and when it was re-examined, they discovered what they called a clear, strong sign of the virus. Now, the WHO said on Friday that it is following up on these cases, but warned that finding patient zero may be impossible.
We may never find who the patient zero was. What we need to do is follow the science. We need to follow the studies and make sure that they are done comprehensively. Any report of cases that were detected through either looking at clinical samples, stored clinical samples, or stored sera into 2019, we are following up on. We are reaching out through our global networks, contacting the researchers directly to find out more information.
This comes as a team of global experts gets to work in Wuhan investigating the origins of the pandemic. The WHO said that they immediately got to work, even from quarantine, having video meetings with their Chinese counterparts. After 2 weeks in quarantine, the team will begin field work, but the WHO said that the study is going to take time and that the goal now is to put the information the WHO China team is collecting into context to better understand the outbreak and learn how to avoid future pandemics. Tony Waterman, CGTN, Brussels.